Good, happy Friday morning, April 17, 2020. I'm Riley King, and welcome to this morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, Attorney General's office investigating suspicious death in Manchester. No danger to public, officials say. Shooting occurred on Brockton Street, officials say. Let's take a listen to that video from WMUR News 9.
Beltate's building supply has been classified an essential business, and we take this responsibility very seriously. Now you have the option to place your orders via phone or email to orders@beltates.com for free delivery or curbside pickup. Stay safe because you matter to us.
We do have breaking news tonight in the city of Manchester. The Attorney General's office has just confirmed it's investigating a suspicious death on Brockton Street. WMUR's Tyler Dumont is there now live with what we're learning. Tyler?
Well, Tom, the AG tells us at least one person is dead at the scene of this shooting on Brockton Street near Forest. Right now, about a dozen Manchester police officers are here investigating exactly what unfolded. Now, so far, we know that police officers responded here at 8:23 tonight for a report of gunshots. They have not yet released many details about what they found when they got here, including information about any victims or possible suspects. However, again, the AG has confirmed one person is dead, and they are considering that death suspicious. Police and the AG also say the shooting does not appear to be random, and they do not believe there is any further threat to the public at this time. Now, at this point, we also have not yet heard any word about a possible motive in regards to this shooting that is very well likely at the center of the investigation that is now underway here. We're live in Manchester. Tyler Dumont, WMUR News 9.
Okay, and there you go on that video and that report. All New Hampshire schools will continue remote learning for the rest of school year, governor says. Decision made to prevent spread of COVID-19. Let's take a listen to that video from WMUR News 9.
In this life, there are only so many things you can count on.
I think it's the right decision. I think we kind of anticipated it.
Caitlin Smith understands why the governor decided to keep schools closed and finish the year through remote learning. It's a challenge, though, juggling work and guiding her 3 young kids.
My children, it was, they were excited. They were home. Everybody's in the same house. Everybody's getting more time, to play. But I think the novelty is wearing off, and I think the concern is going through the rest of the school year.
Each district has control over its program, but the state is encouraging a move to a pass-fail grading system to help students and families. Concord High will give them a choice, a pass-fail option, or take the grade that the student actually earned.
What I'm hearing from a lot of folks is we've never been this connected with families before, because we're talking to not only the student, but we're talking to the family as well.
Interim Superintendent Frank Bass says students are rising to the challenge, finding new, creative ways to learn.
We got kids that are actually doing a newspaper at the elementary level. They've created a newspaper.
Sununu saying it was a tough but necessary move.
Graduation is not going to look like it does for them, as it did for maybe their friends that had come before them, senior prom, all those types of things, unfortunately, are going to look very, very different.
Well, school may not look the same in September either. Sununu says it'll need to include opportunities for students who fell behind in remote learning to catch up in the fall. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. COVID-19 in New Hampshire, what you need to know. Let's take a look. And here is that COVID-19 information, what you need to know. There are 1,211 number of people in New Hampshire have tested positive for COVID-19. 648,788 number of people in the United States who have tested positive. 34 number of deaths from COVID-19 in New Hampshire. 187 number of people who have been hospitalized with COVID-19 in New Hampshire, and 30,920 number of deaths from COVID-19 in the United States. This map of New Hampshire shows where cases of COVID-19 are in towns and cities of New Hampshire. Salem, 50-plus cases of COVID-19. And this graph shows new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. And your common symptoms: fever, cough, and difficult breathing. How it spreads, and prevention tips. New COVID-19 outbreaks identified at 3 New Hampshire long-term care facilities. 2 new deaths linked to coronavirus announced. Let's take a listen to that video from WR News 9.
These are truly challenging times, but New Hampshire companies are here and open for business.
Mid-State's healthcare team.
Adams State health officials say they're seeing regular patterns of asymptomatic people in these facilities, and one way they're trying to fight that trend is through testing. Tonight we have learned of 3 new outbreaks. One at the Institute of Professional Practice in Concord, where DHHS says 2 residents tested positive for COVID-19. 1 has died, and 6 staff members also have the virus, though they have not had any positive cases for several days now. The residence at Salem Woods is reporting 21 residents and 4 employees testing positive, and Bellamy Fields Assisted Living in Dover has 5 residents and 5 employees with the virus. The state advising facilities to test new admissions and have employees stay home if they show any mild symptoms of sickness.
When we find a positive case in our long-term care facilities, we're sending our mobile team to take specimens if the facility is not able to do that themselves. And we are testing all of the residents in that unit or in that facility, depending on how large the outbreak is.
And starting on Monday, Convenient MD will begin testing all employees at long-term care facilities, every long-term care facility in Rockingham and Hillsborough counties. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Some fire chiefs ask governor to close campgrounds to prevent spread of COVID-19. Campgrounds able to operate with some limitations. Let's take a listen to that video from WMUR News 9.
In this life, there are only so many things you can count on. The sun rising every day.
The Friendly Beaver Campground is open to their seasonal campers right now, but this year there are new rules in place.
We did require they stay on their sites, keep their social distance if they wanted to go for a walk. None of our facilities were open. None of our rec halls are open. The store's not open.
Steps they're taking to prevent groups from gathering.
It's basically a place just to come, enjoy their trailer, and then leave.
But some fire chiefs in the state want them closed and are now asking the governor to alter his decision.
We're trying to look out for our residents, and we feel bringing people from south of the border up here right now is not in the best interest of our residents.
North Conway's Fire Chief Stephen Solomon says New Hampshire is a tourist destination, attracting people from surrounding states, and some of those places have high numbers of COVID-19.
Opening the campgrounds is an invitation for people to come here from there. We think that's counterproductive. It doesn't protect our residents.
The chief is now working with other towns to get their message to the governor.
And, I don't want to see them be adversely affected by this, nor do I want to see anybody else adversely affected, but we have to take public health first.
If the governor doesn't close campgrounds, Chief Solomon says he's trying to figure out if towns have the authority to close them themselves. Reporting in New Boston, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Don't avoid emergency departments for medical crises, doctors say. Number shows some may be avoiding hospitals even during emergencies. Let's take a listen to that video from WMUR News 9, Jennifer Crompton.
Beltate's building supply has been classified an essential business, and we take this responsibility very seriously. Now you have the option to place your orders via phone or email to orders@beltates.com for free delivery or curbside pickup. Stay safe because you matter to us.
Fear of exposure to COVID-19 is having an adverse effect in the emergency department at Portsmouth Regional Hospital.
We typically see a large number of people who are very sick, and we're not seeing the same number of people coming in, and we're worried that people are not seeking care when they really need to.
Before the pandemic, those with serious health concerns knew to get care immediately.
And what they're seeing now is people are maybe delaying, sometimes hours, sometimes days, and the interventions we could have are much less effective after a period of time.
Their message is that their ERs at Portsmouth, Parkland Medical Center, and Frisbee are some of the safest places to go right now.
People will be masked, they will have their temperature checked, they'll be asked a series of questions, and they'll get back into a room where they can be assessed by a medical professional.
Andy says that COVID patients or those with symptoms are in a separate designated section. They aren't commingled, and that there's a rigorous sterilization and cleaning process between patient visits.
It's safe to go to the emergency department, and it's certainly safer than sitting home with chest pain, shortness of breath, or neurologic changes that could be an indication of a stroke.
The message is still to contact your primary care physician if you have concerns, or 911 if it's a medical emergency. But the bottom line is, do not hesitate to get the call you need. We're live in Portsmouth. Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. NHIAA announces 2020 Spring Sports and Championships canceled. Health and safety priority. Let's take a listen to that video from WMUR News 9.
Beltate's building supply has been classified an essential business, and we take this responsibility very seriously. Now you have the option to place your orders via phone or email to orders@beltates.com for free delivery or curbside pickup. Stay safe because you matter to us.
It was something that I think we were all somewhat expecting. It was definitely a disappointment to hear about it, but it's what needed to be done.
We've been following Elise Buchanan since she's been hitting it out of the park for the Bedford varsity softball team. Now this senior says she respects the call to cancel spring sports.
You are the team captain, so what message are you sending to the team now?
I think that we all just have to keep our heads up, and everyone else who's not graduating this year just has to look forward and work towards next season and be excited for that. And everyone that's graduating, we just have to be happy with what we had in our past and all the years that we played together. Sometimes if we have to sacrifice those small things, it's all worth it for the larger outcome.
This just had to be a heartbreaking announcement to make.
Absolutely. There's no question about that.
The NHIAA executive director says with school out and health a top priority, this was the only decision. He says close to 20 other states have done the same, with more to follow. There's hope for fall sports, but right now, hearts are with seniors walking away from their final seasons.
Strength and resiliency, these are the attributes that we teach in sports and that are learned through sports. And, it's a tough lesson, there's no doubt about it. But, I have all the faith in the world in this class of 2020 because they came into the world during 9/11 crisis. And they're going through this, their senior year. They're all going to be better off for the things that they have done and the obstacles that they've faced and overcome.
Jean Mackin, WMUR, News 9.
Okay, and there you go on that video and that report. Dow features rally after Gilead's coronavirus drug reportedly shows effectiveness. U.S. stock features surged after a report of Gilead Science drug showed effectiveness in treating the coronavirus. The move pointed to a jump for the stock market on Friday. Trump unveils long-awaited guidelines to reopen U.S. Let's take a listen to that video from ABC News.
Good evening, and it's great to have you with us here on a Thursday night. President Trump just moments ago saying it is time for the next front in this war, were his words. It is time to open up America again, saying we have to do it, that Americans want to be open again, adding Americans can defeat any challenge, that we will carry our nation forward. President Trump offering new federal guidelines, allowing governors to take a phased opening, saying he has worked with the governors, Democrats and Republicans, that they have a good relationship. Dr. Deborah Birx will spell out the guidelines shortly. Among the first steps, governors will be expected to show a downward trajectory of cases within a 14-day period. The president says this will be a gradual process. Of course, he's certainly aware of the numbers. The death toll in the U.S. now topping 32,000. Here in New York, Governor Cuomo extending his stay-at-home order, a pause here in the state until at least May 15th now. Even with another 600 deaths here in New York, the hospitalization rate still dropping. The governor says he is very concerned a reopening of the state too soon would drive up the infection rate, saying increased testing right now is what's needed before we can get people back to work. New unemployment numbers out tonight. Another 5 million Americans filing for benefits, now 22 million losing their jobs in the last month. Families in need in long lines at food banks. This line right here in Dallas just today. The president said moments ago some states will open sooner than others, saying they are not facing the same situation, saying Americans will have to telework. Those who are sick must stay home. Americans will have to keep a safe distance. So how will this work as we all try to navigate this road ahead? ABC's Whit Johnson leading us off.
Tonight, President Trump unveiling long-awaited guidelines to reopen America, but making it clear the governors will call the shots.
We're opening up our country, and we have to do that. America wants to be open, and Americans want to be open.
The president's guidelines call for a phased approach. States would be able to move to phase 1 after they see a 2-week decline in the number of people with COVID symptoms and in the percentage of people testing positive for the virus. They would also need to implement a robust testing program for healthcare workers, including emergency antibody testing. Once a state can check those boxes, people would still be advised to maintain social distancing and avoid socializing in groups of more than 10. But businesses could look at ways to slowly return to work. If states are able to go 2 weeks without a rebound of COVID cases, they can move to phase 2, where you could see places like restaurants, movie theaters, and bars reopening with social distancing protocols.
One careful step at a time. And some states will be able to open up sooner than others. Some states are not in the kind of trouble that others are in.
The guidelines come as New York, Los Angeles, and Washington, D.C. extend their shutdowns until at least May 15th.
What happens after then, I don't know. No political decisions, no emotional decisions, data and science. We're talking about human lives here.
Here, the numbers are heading in the right direction, but slowly.
The bad news is 2,000 people walked into a hospital yesterday for the first time with the disease. And the worst news is 600 people died yesterday from the disease.
Doctors like Melanie Malloy in a relentless battle for weeks.
I have a great babysitter who helps me a lot, but sometimes it's a little bit hard.
She takes us inside the emergency department at Mount Sinai, Brooklyn.
Most of our beds are taken up by intubated patients, meaning patients who can't breathe on their own and who are on the ventilator.
Dr. Malloy telling me today she's encouraged that fewer patients are coming in, but says one of the most difficult parts of the job, treating her own colleagues who've fallen ill.
So I just needed to get out of the ED for a little bit. Sometimes you just got to step out for a second.
New York banding together with 6 other states to plan for reopening. Out west, California, Oregon, and Washington forging a similar alliance. And now a new coalition of 7 Midwestern states, including Ohio, where Governor Mike DeWine today announced a plan for some businesses to reopen on May 1st.
We must get people back to work.
Governor DeWine brandishing a mask his wife Fran made for him. He was one of the first governors to act on the COVID threat. Tonight, governors and health officials alike agree the key to the future is testing and tracking the contacts of people who are infected to prevent further spread.
I work for Salt Lake County Health Department.
Salt Lake City says its team of 130 tracers has successfully tracked 85% of the cases in the community.
What date did you start to feel like you had some kind of symptoms?
Massachusetts unveiling its own ambitious plans to hire 1,000 people for contact tracing. But some unwilling to wait. Protests erupting from Minnesota to Oklahoma to Michigan in defiance of social distancing guidelines.
The sad irony here is that the protest was that they don't like being in this stay-home order, and they may have just created a need to lengthen it.
There's going to be so many different calls across this country as governors have to look at their own conditions in their own states. With Johnson back with us tonight, and I wanted to get back to what the president said just as we came on the air tonight. He called it the next front in this war, opening up America again, and he called it a science-based reopening and made a point of saying some states will open sooner than ever.
And David, once again, President Trump is focused on our borders, saying, quote, we must be extra vigilant in blocking the foreign entry of the virus, adding that border control, travel restrictions, and other limitations are more important than ever. He also pointed to the data, saying that 30% of the counties in this country have reported no new cases of coronavirus in the last 7 days. David?
All right, Whit Johnson leading us off on the news tonight from the president. Whit, thanks.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching. Have a great rest of your day. And I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.